Welcome.
Got it. Hello.
Hello.
Okay.
We'll be starting in about a minute.
How are you?
Hi, waiting for everyone to come in.
Okay, praise the Lord.
Praise the Lord. Good afternoon, everyone.
Good afternoon.
Praise the Lord.
Praise the Lord. See everyone coming in. I want to give everybody a minute to get connected before we begin. You all please mute when you come in, please. Thank you. Praise the Lord. Good afternoon. Good morning, good evening. Thank you for muting. Okay. I think we can begin. I want to get right to it because this is very exciting. We've got some great information. So praise the Lord, women of ACOG, invited guests. Thank you so much for joining us. My name is Dr. Karana Mason, and I want to welcome you to our Health and Wellness series. We would like to acknowledge our pastor, Dr. Byron Brazier, lady, Evangelist Mary Brazier, and the moderator, Kelly Medius, and the Health and Wellness team. I see some people are still coming in. Just make sure if you're coming in, please mute your Zoom. So I would like to begin with the prayer. I guess in, but maybe not. Maybe I need to wait a little minute or so since folks are still coming in. Okay. So I'm going to begin with a prayer. Dear Heavenly Father, thank you so much for allowing us to come together to get the information, to open up our hearts and minds for the information that will allow us to glorify the temple that you've given us. In Jesus' name, amen. Okay, so as folks are in, our theme is the truth about my temple. Taken from 1 Corinthians chapter 6, verse 19. What? Know ye not that your body is the temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own. Today's topic in our health series is skin health, and it's presented by Dr. Brooke Jackson. Dr. Brooke Jackson is a board-certified dermatologist and dermatologic surgeon. She's a best-selling author, 10-time marathoner, and health skin advocate, and owner of Skin Wellness Dermatology Associates in Durham, North Carolina. After completing 2 fellowships, laser surgery at Harvard, and a second in Mohs, she founded the Mohs Surgery Unit at MD Anderson Cancer Center in Houston. She then moved to Chicago, where she founded the Skin Wellness Center of Chicago, and developed a clinic and was a clinical faculty position in the Department of Dermatology at Northwestern. In 2013, Dr. Jackson relocated to the Triangle area. She was an associate professor of dermatology at the University of North Carolina, Chapel Hill, until opening her private practice, Skin Wellness Dermatology Associates. Dr. Jackson's practice philosophy focuses on patient education and skin wellness. By educating her patients about their skin and hair concerns, Dr. Jackson creates a customized and innovative treatment plans so they can look and feel their best and love the skin they're in. She is a frequent and sought after guest and resource for national and local media on dermatology concerns, an avid runner, a budding triathlete. Dr. Jackson has completed 10 marathons. She is married with 3 very active children and has written 2 books, Child of Mine, Caring for the Skin and Hair of Your Adopted Child, which was published in 2010, and most recently, Skincare for Runners in 2021, a #1 Amazon new release bestseller. She has developed a product line for athletes called joylaskin.com. Dr. Jackson, welcome.
Thank you so much. Thank you for having me. And I'm very excited to talk about one of the things that I just love to share is information about your skin and how you can love the skin that you're in. So I am going to share my screen. If I push the right button. Are we good? We're good? Okay. All right. So this evening, we're going to talk about caring for the skin that you're in. So first, what is a dermatologist? A dermatologist is a medical doctor, an MD, who has completed a residency training program in dermatology. And dermatology really encompasses all of the diseases of skin and hair and nails. Derma is Greek for the word skin, and dermatologists treat just about everything that can happen to your skin, your hair, and your nails, including rashes, skin cancer, acne, aging. Historically, dermatology was, the specialty is called dermatology and venereology, which is STDs, but we don't talk about that anymore. So anatomically, I'm going to take you all back to your 8th grade biology class just for a hot minute, just so we can relearn some things about the skin, because the structure of the skin really plays a role in how it ages and all of the other disease processes that we see. And so, I'm not sure if this, can you all see this sort of as a pointer or no? You can, okay. All right, so the skin is the largest organ of the body, which actually means that dermatologists are the most important doctors, because we have the most real estate to care for. So the weight of our skin is about 16% of your total body weight. And if you stretch it out, it does stretch out to about 20 feet long. And so it's very, very large. Skin actually does have some specific functions. Most importantly, the function is as a barrier between us and the outside world. So I always tell my patients, your skin is like saran wrap. It keeps our insides in and the outsides out. And when we have rashes or irritation of our skin, it's almost like you poke little holes in the saran wrap in your refrigerator. And so now you smell onions. And so we always want to make sure that our saran wrap is intact and is fully functioning. The skin also helps us to synthesize vitamin D. And so it's important for us to get a little bit of sun exposure, but that is not the only source of vitamin D generation. It regulates our temperature. So when you get goosebumps on your skin, that means that you're chilly or nervous. And it also allows us to feel, which is a sensation of touch. So why does the appearance of our skin matter? Well, sadly, we are a judgment-based society. And so often people will make a judgment based on what your skin looks like and really form an opinion about who and what you are. And so while it may seem very superficial, the reality is skin that is in good shape will help you to get a better job. It will help you to potentially get a spouse. And so there are a lot of reasons to make sure that your skin is looking and feeling its best. And it also plays a huge role in self-esteem. So if you look at these pictures, and on your left versus the right, these are the same people, but you can see that one side of the skin is not in great shape and the other has been corrected. So whether it is sun damage or acne or wrinkles, as you judge the first look or the first feeling that you have when you look at these pictures, the likelihood is when you look at the picture on the right side, you feel a little bit better about looking at this person because their skin looks better. So I do give a lot of lectures about skin and skin of color and diversification of the standards of beauty. And as African-American women, we have all been, thankfully things are getting a little bit better, but we have all been fed that the standard of beauty is really the European standard. And as you can see, even with the People magazine covers, the first one was from 2000 with Julia Roberts, who's beautiful. But when you think about Cheryl Tiegs or some of the white supermodels, that is what we are told is a standard of beauty. And it hasn't been until recently that we start seeing ethnic standards of beauty like Lupita Nyong'o. And so seeing somebody with brown skin and curly hair and being told that we are one of the 50 most beautiful people does a lot for the self-esteem of little girls of color. So as far as the skin of color, the population is changing. And so the statistics now are that by the year 2050, which is not that long from here, about 50% of the US population is going to have skin of color. And so this is varied racial and ethnic groups, which really are very, very difficult to categorize. But often, as I tell my patients, the goal and the standard of beauty is really to enhance what you have and not necessarily to change you into something that you do not. And this is one of my favorite group pictures. It's probably about 10 years old, 15 years old now, but looking at all of these beautiful ladies who are all different shades of brown and beautiful in their own rights. And so this is really one of the beautiful things of brown skin is we come in all different shades and colors and sizes, but gorgeous in our own way. So we talked a little bit before about the structure of skin, but I want to chat just for a moment about the differences between skin of color. And so the stratum corneum is the top portion of your skin. And that is really what sort of flakes off as we have dry skin. Melanocytes are the cells that make us brown. And when we have darker skin, everyone has the same number of melanocytes, but those people who have brown skin, those pigment producing cells are more active. So we actually make more pigment. We still have the same number of pigment producing cells as people who have white skin. Melanosomes are the package of melanin. And so the melanosomes in people who have brown skin tend to be larger and spread throughout the entire thickness of the skin. And they also tend to be a little bit more easily irritated. So this is one of the reasons why people who have brown skin tend to suffer more from hyperpigmentation, because our skin cells, which make us brown, are just highly reactive to any kind of trauma. And so when we look at different ethnicities as far as what their concerns are, the number one issue always in brown skin is discoloration. We also have fibroblasts, and those help to form scars. And because the fibroblasts in brown skin tend to be larger, this also explains why people who have brown skin are more prone to developing thicker scars and sometimes some keloids. So as you can see with these two ladies, and these are actually two patients of mine who are the exact same age. They were both 75. And the Caucasian woman clearly has a lot of sun damage, and the African-American woman looks like she's about 50 years old. And so this really drives home the point that I made earlier, that aging, some of it has to do with sun exposure. And so clearly the Caucasian woman has had a lot of sun exposure. In fact, she was one of my skin cancer patients. And the brown skin patient, probably not so much sun exposure, but her skin tends to be a little bit oilier. And I always tell my oily patients, it is a blessing. I know you hate it when you're younger, but as you get older, people who have oily skin age so much more gracefully. So we don't want to hate it. We want to love on it if that's what was given to you. But what we do notice too is regardless of skin color, as people age, we have what's called gravitational changes. And so that's sort of the sagging and the drooping. And that's really due to lack of support from the inside, not necessarily what's going on the outside. So typically the concerns of skin of color, the first and foremost concern is discoloration. And so whether that is related to chronic sun exposure, sometimes being made worse by some medications like high blood pressure medications and diabetes medications, but often some from inflammatory conditions like acne and eczema. Scarring does tend to be an issue as well. Often my brown skin patients tend to be a little furrier than others, so that means excess hair as far as hypertrichosis. Pseudofolliculitis barbae are some of the hair bumps that we might see in the chin, and also African-American men often get in the back of their neck. We have benign growths, acne keloidalis nuchae, typically in the back of the neck. We also have little moles, which a lot of people will call dermatosis papulosa nigra, easily removed. Most people tend to also develop some mid-face aging, typically in the 30s and the 40s, and also wrinkles. So that's where we, like on their forehead, that's what we would treat with Botox. Hispanic patients often have some of the same concerns, although they tend to have more of an inflammatory component rather than discoloration. So hyperpigmentation, it's really related to any kind of inflammatory condition. So that's why we call it post-inflammatory hyperpigmentation. A lot of my patients will come in wanting to work specifically on the discoloration, but I always tell them we can't get that any better until we take care of what caused it. So whether the underlying issue is acne or eczema or seborrheic dermatitis, it's very, very important to make sure that we get that controlled, because often that will stop the progression of any kind of hyperpigmentation and ultimately help it to get better. So we do know that hyperpigmentation can cause significant psychological effects on patients. As you can see with these two ladies, they both have acne, but they're both pickers. And so a lot of patients do pick at their skin, whether that is due to stress or anxiety. I've certainly seen an uptick in all of those things during COVID, and certainly the lower facial acne with mask wearing. But post-inflammatory hyperpigmentation does tend to be one of the first and foremost causes for patients to walk in my office if they got brown skin. So let's talk about aging. And here we have Lady O. And so this was on the cover of her magazine. She always has a picture of herself on her magazines, but this was a picture of her at age 21 and also then at age 56. And again, when you look at her pictures, you know, granted, she's got all sorts of helpers these days and people, but I think she looks much better at age 56 than she did at age 21. And some of this is coming into your own, and she certainly talks about self-esteem and sort of growing into yourself and more of a confidence as an older woman. But, you know, as far as her aging and wrinkles, she looks pretty much the same, age 21 and 56. And so this goes back to the adage that black really don't crack. So I'm going to go through the decades of what usually happens to skin and what we can do from a preventative standpoint. And so typically in your 20s, that really does lay the foundation for what your skin is going to look like for the rest of your life. So that's why it's really important if you've got daughters or you know, nieces or nephews, that you really talk to them just as you talk to them about hygiene, taking care of your teeth when you're a child. You want to start taking care of your skin when you are in your 20s. And that includes sun protection, regardless of what your skin color is. You definitely want to avoid tanning and avoid smoking. I always tell patients the worst thing you could ever do for your skin is to be a smoker. You want to make sure that you're getting all of your inflammatory conditions under control, such as your acne, because that way we won't have any hyperpigmentation. And you really want to develop some good skincare habits. They don't have to be 12-step programs and have 50 million things all over your counter. I'm very much into let's minimize it. Everybody's busy. Couple things, let's get it done, but easy breezy. I don't like to overcomplicate things. So acne scarring, usually related to chronic inflammatory conditions. And so when I have teenagers or even patients who are in their early 20s and early 30s, it always breaks my heart, especially when I start to see acne scarring, or even when I'm out and about and then I see people with significantly inflammatory acne. Their parents may say, well, you'll grow out of it. You don't want to wait until we grow out of it, because that's how you end up getting scarring. And scarring is much more difficult to treat than discoloration. And there is a difference. A lot of people call discoloration scarring. It is not. And so scarring is actually a textural change. If you feel your skin and you feel something that's a little bit elevated or a little bit of a dip to it, that is a true scar. If you can't feel hyperpigmentation. So I always tell patients feel. We, as dermatologists, we use all of our senses for diagnosis and treatment. And so you always want to feel if it's truly a scar. We talk about a different treatment plan. But ideally, we, again, want to get into early intervention and make sure that we get the acne under control. I have patients come in and they bring in 10 and 11-year-old children in to get started. And I think that's perfectly appropriate. If you have children and they're starting to develop teenage acne and they're 10, 11, 12 years age, It's usually around the time that the period starts or around the time that the hormones are starting to kick in. It's fine to start with the drugstore products. I think there are plenty of good ones over the market. The fact that there's one different that actually used to be a prescription, I think that's a great place to start. But after about 2 or 3 months, if you are still having breakouts and it's getting worse, I think it's time to intervene. And as dermatologists, that's what we do all day, every day. And so, a lot of patients are afraid to go to dermatologists for whatever reason. I think we're actually pretty nice people, but they want to try all of these things on the internet. They want to, try a bunch of things that really just don't work. And so we really do kind of cut to the chase. We get to the root of the problem and we will get you treated and faster than anybody else in business. And so don't be afraid to go see your dermatologist. So if we have acne and textural irregularity, there are definitely some options for treatment. We always have to be a little bit more cautious and careful in brown skin. And again, weekly, I see patients who have been too aggressive, gone someplace else, med spas, people who just aren't used to or comfortable, or there's a healthy fear that comes along with treating brown skin, because we always do not want to make things worse with the treatment. I have to balance that sometimes with my conversations with my brown patients who want to, do the same things that their Caucasian friends are doing. They want to go to the spa and get this treatment or that treatment, and they want their hyperpigmentation gone like yesterday. But I'm like, slow down, because when you go too fast, that's when you're going to get in trouble. And so always a good idea just to kind of don't push too much. So acne and hyperpigmentation. So this was a woman who she had rosacea. And so we think that rosacea is something that only happens in Irish folks, but Black people get it too. And so she had actually been to a couple of different practices, and she ended up in my office, and so we got her treated actually relatively easily. But rosacea is a form of acne that tends to occur in the late 20s and early 30s. It also tends to occur in people who have more sensitive skin. And there are definitely some triggers that make it worse. And as I mentioned earlier, skin is one of the largest organs that we have. It is also considered an immune organ. And so that means when we are stressed out, our immune system does not function very well. And so that is one of the reasons why a lot of dermatology patients have been on the struggle bus, standing room only, the last couple of years, particularly with COVID and all of the stressors that has produced for us. And so we're seeing a lot of flares, but I put her on some medication. We did some chemical peels, and this was just after a couple months in treatment and significantly better. It's another patient of mine who, this was pre-COVID, but I have a little program in my office called Acne Boot Camp, and we include some topicals as well as some chemical peels, and chemical peels are safe in brown skin. It's just, you have to know what you're doing, and whoever's treating you needs to know what they're doing as far as brown skin. Hyperpigmentation, again, you got to be careful. This was a patient who I inherited from another practice, and they had used a laser on him to try and take care of the hyperpigmentation, and they actually ended up making things much worse. And so part of my challenge with him, and I will share with you, this young man walked into my office. He wouldn't even look at me. His head was hung low. He was in his 20s, very good looking guy, but he was walking around with this. And so, after a couple of weeks of some topical treatments, I had him stop everything. So sometimes the best answer is to slow down and stop doing things that are going to make it worse. And that's kind of what we did. I pulled him off of everything else that I was using. I gave him a topical treatment, and this is really about 2 weeks later. And he was thrilled. He was very, very happy. This condition is called pseudofolliculitis Barbie. So this is basically ingrown hairs, very, very common in African American skin. And so this woman had also gone somewhere else, and she had a bad experience at a laser facility because they burned her. And it's really my practice philosophy. I don't try to encourage anyone or try to convince anyone to do any treatment, but with her, I did, because the only way this is going to get better was really to take care of the hair. And this is without any treatment other than just the appropriate settings, using laser to get rid of the unwanted hair. And a lot of the hyperpigmentation got better on its own. And so sometimes, again, you have to just get back to the root of the problem, treat the inflammatory condition, and everything else will fall into place. This is another patient of mine who, she actually had a birthmark. And so this was not hyperpigmentation. I ended up doing a biopsy, and we used a different type of laser on her, the same type that we would use to remove a tattoo to make this birthmark better for her. Because the topicals and other things that she'd been trying previously were not working. So sun protection, lots of conversation about, I think the Caucasian people generally get it, but we really want to make sure that the brown people get it as well. But this is an example of why sun protection is so important. So this person on the left-hand side was a truck driver. He drove a truck for 30 years. And the left side of his face is the window side. And so this is what he wore no sunscreen. This is what 30 years of sun damage would do. This picture is not retouched. This is the inside of his cheek, the cab side. And so no sun exposure. And this is what 30 years of sun damage will do. Lindsay Lohan, she's had a hard life, smoking, drinking, lots of activities, but she looked much older than her stated age. This picture was taken when she was about 25 years old. She looks like she's about 45 years old. And so back to my earlier comment about one of the worst things you can do is smoke and suntan. So ethnic skin does get skin cancer, and it tends to be not thought of all of the time as we would with the Caucasian patient. So I always tell my brown skin patients often, and I've written 4 book chapters on skin cancer and skin of color. Squamous cell carcinoma is typically the skin cancer that happens in brown skin. And sadly, it also often happens in places where the sun doesn't shine. And so it is a misperception that the only reason you get skin cancer is because of sun exposure. That is not true. We can get skin cancers in area of trauma. For example, if you have radiation therapy, if you were the victim of a burn, any area that has to chronically heal potentially is at risk for squamous cell carcinoma. And so I always tell my patients, it is not your job to figure out your diagnosis. It is your job to recognize when something is not looking right or behaving well, you're not healing up like you should, then you should get it checked, because it is not out of the realm of possibilities that it could be a skin cancer. Bob Marley died of a melanoma, so it does happen. And so anything that is looking different, that is not healing up in a reasonable amount of time, really should be looked at by a dermatologist. So back to smoking, sort of a theme here. Smoking, the skin just doesn't heal up very well. And I will share with you, I also do quite a bit of cosmetic work with fillers and Botox. And if I have a smoker, I will not treat them. I will not do fillers in smokers because their circulation is poor. And if you have an injury, and most plastic surgeons won't do procedures in smokers either, because they just do not heal up well. You have decreased circulation, and if you have an injury, it's just not going to heal up very well. So again, if you're a smoker, please do your best to stop. Some twin folks, and these are twin pictures of smokers. All the smokers, clearly look like smokers versus their twin. And so they have the same genetics, but this is just the difference of what smoking will do to your skin. In your 30s, so this is when we embrace everything. This is typically when we tend to be at our structural peak. Most people have sort of leaned out where you figure out your body weight, you've sort of matured into what your face is going to look like. And so most people are looking pretty good in their 30s. We do start to develop some benign growths on the face. This is also when we start to see, or truly when the collagen production starts to decrease. We don't see the effects of that really until the 40s, but every year we lose about a tablespoon of collagen per year. Collagen is what supports our skin. And so that is reason why when we're in our 40s, our skin doesn't bounce back like we did. It just doesn't have that so doughy look. And we start to get some discoloration. It becomes much more apparent. And so when people have had a lot of sun damage, it doesn't really show up in their 20s. It starts to show up in their 30s. And so we start to see the effects of how we've been living in our 20s and younger years. And so the 30s, really we want to work on foundational support for our skin. And so this is where you probably really want to start with your skincare regimen. If you haven't been wearing a sunscreen, you most certainly want to make sure that you get one going. You may want to start on a little over-the-counter retinol or vitamin C serum, because these things will help with hyperpigmentation, and they will also help, particularly the retinoids, will help to build collagen. I always tell patients that retinoids are like a deposit in your skin's 401k. You are going to reap the benefit of it as you get older. And when I see patients in their 50s and 60s, I can always tell if they were on a retinoid for acne or they started one earlier because their skin looks much better. And so you definitely want to start to address the fine lines, which can start to appear in the 30s, and also the discoloration. But we want to start doing some things to help with the collagen production. So this is another slide of a gentleman who's actually a firefighter, and he had a lot of scarring, and we did a couple of treatments with a laser. I work with a lot of companies to work on the parameters for lasers in skin of color, and that was actually my passion project when I was doing my laser fellowship up at Harvard. I helped to develop the parameters for laser hair removal, and so I work with a lot of companies to help to figure this component out for skin of color. And so this was a laser called Fraxel, and I did this with this gentleman, only 2 treatments. Because he was a firefighter, we had to be very careful about him having almost no downtime because he had to put on his firefighter gear and make sure that we weren't giving him any other additional wounds to heal from that would have been a problem while he was doing his job. Another patient of mine who's in her 40s, she's now 50, acne scars when she was younger. She had actually been on Accutane, and just after a couple of treatments, we were able to really give her a much better contour. And the side benefit of working with some of the collagen and fixing the scars is if you look right here on the sides of her mouth, she actually got a little bit of a lift and some support. So collagen is supportive for our skin. And so she was able to make sure that her skin was a little bit tighter for the treatment. So some of the other growths, these are called dermatosis papulosa nigra, very, very common. A lot of African Americans call them moles. They are not. A true mole is made up of a different type of cell called a nevus cell. These are benign growths that literally sit on the top surface of your skin. And so you can see just removing them, I call this taking away the background noise. It just makes your face look so much clearer and younger. And this is one of my favorite procedures to do because it can really turn the hands of the clock back about 10, 15 years very, very easily. Another thing that I see very commonly is a split earlobe, and it's usually from a heavy earring or a baby that yanked it or catching on a sweater. Very, very easily fixed, and then you can wear your earrings again. Tattoo removal, you know, some of the things that you do in your 20s, you regret, and you want to get them off when you're trying to get a job and older. And so this, I share this picture with you because this is one of my favorite patients. He was a gang member when he was in his 20s, and he came to me in his 40s. He'd gotten a job. He was now going to church. He was born again Christian, and he liked to play basketball. But when he went on the basketball court, he was afraid because he still had all these gang tattoos, and that was no longer the life that he lived. And so I was able to work with him over the course of about 6 months and get these tattoos off, and it just made a huge difference for who he was as a person and was removing the reminder of who he used to be. And so there are also clinics around the country that do this free of charge, especially for gang members. And so you have to kind of search around for them, but this is one of the things that as dermatologists we love to remove because it can really change somebody's life. So in your 40s, this is really when we start to see the ravages of sun damage. We start to see more skin laxity. We start to see some volume loss. And so this is typically when people may start doing fillers. We start doing some other procedures just to build collagen like Volthera. There's another procedure called soft wave, which is collagen building. Depending on when hormones start changing, we start to see some loss or perimenopausal changes as well. And so this is another anatomic photo of really, if you think of the skin as a tablecloth, we start to have some dents in our table. And so we want to make sure that our structure is good so that our skin drapes better. And so this is a woman who was in her 40s, and she was actually in a study I did while I was in Chicago on another toxin. So we did her before and after photos. And so this is, we weren't able to do anything else, and it was a standardized dose, but this is, you can see she looks more relaxed and her eyes are quite a bit more open. So this is just Botox, and trust me, if you're not doing it, everyone else around you is. So it's easy enough to do. Cellulite is another issue that a lot of people suffer from. And there's actually now a new treatment that just came on the market last year called Quo that can be very, very effective. It has a little bit of downtime, but for people who want to wear a bikini or wear thongs, and this can certainly be something that could be helpful. Often we focus on the face, but aging signs can also be apparent on the neck. And I always tell my patients, you want to make sure that you are the same age from head to toe. So your face can't be one age and your neck can't be another and your hands can't be a third age. We got to keep it all together. And so when we start doing the face, I will often start talking to people about treatments for their necks and also the back of the hands. And so the hands will definitely tell your age, and a lot of people completely neglect their hands, and we beat up on them a lot, especially with hand washing and gels. And so, and one thing I will mention to you, if you all are doing manicures and you go to the nail salon and they put you under that light, please put some sunscreen on. That light is UV light, which is the same thing as putting your hands in a tanning booth. And so we are starting to see skin cancers. There are some manicure gloves you can get on Amazon. You just slip them on, or you just tell them you're not going to do the light. But I would highly suggest that you do not use those UV lights at the manicures. So structural support, we also see it around the eyes. And so you can see that with treatment, this is an injectable treatment called Sculptra. And you can see that she still looks like herself, just a younger version of herself. This bottom picture is a treatment with a woman who's in her 40s. She's got beautiful cheekbones, but you can see she's starting to have a little bit of loss and lack of support on her lower face and under her chin. And then around the eyes, the eyes are the window to the soul. And so we want to make sure that they're nice and open. So 50s and beyond, and I am going to start wrapping this up in a few minutes. 50s and beyond. So this is when menopause starts to kick in. And menopause can cause dryness of the skin. We start to see some acne with a hormonal shift. We also see a lot of sun damage and discoloration and skin laxity. And so often with my perimenopausal patients, they will come in with lots of complaints. So like they're going through change and they're losing their hair, but they have acne and wrinkles, and it just tends to be a little bit of a hot mess. And so we do have some effective treatments for all of these concerns. And so this is a woman who is in her 50s, and you can see she just looks a little bit tired. She was starting to have some facial droop and a little bit of discoloration. Often perimenopausal patients can complain of some itching. The term for that is called formication. Pronounce that very slowly and carefully, formication. And so this is a crawling sensation that can be on the skin. I always want to make sure that there's nothing else going on. So not out of the realm of possibilities to check some lab work and make sure your thyroid is good. There's no other reason for you to be itching, no liver or kidney problems. Your vitamin D level should be good, but it can also be very easily treated. Itching just in general can be an issue. Often there are some undiagnosed thyroid issues. And so we're medical doctors, and we want to make sure that there's no other underlying condition that needs to be addressed. Dry skin care, often as you go through the decades, you have to change your products. So I tell people every time there's a 0 behind your birthday, you have to heavy things up a little bit. And so the products that you use in your 20s will not be the same ones that you use in your 30s and your 40s. You need more moisture, you need heavier products as you get older. I lived in Chicago for 10 years, and we know that the weather is significantly, a lot of drastic weather changes. And so also, like you change your wardrobe, you change your products. So in the winter, when you have on a sweater and the heat goes on in the house, you need products that are a little heavier. So out of a jar, In the spring and summer there, when it's very humid, you don't need heavy products. So you can kind of lighten things up a little bit. So change your products as you change your wardrobe. Hair loss is a huge conversation. And so I'm going to click through a few of these slides. There are some definite treatments available for it. So you don't need to suffer in silence. But one of the things that I have noticed with a lot of my hair loss patients is they wait until they start to come in to address it. And so just like they say at TSA, if you see something, say something. If you start to notice thinning or shedding, come and get it checked out, because as with any disease process, the earlier you intervene, the better the prognosis and the more treatment options you have. And so this is a woman who clearly had waited for a very long time. We were able to get some recovery. And so, this is just after a few months of treatment, but she has a scarring type of hair loss, which is much more difficult to treat. And so the conversation about hair loss is a very large, long conversation. Sometimes we do a biopsy, sometimes we check some labs, because we can have hair loss related to thyroid problems, to nutritional changes, absolutely related to stress. So the type of hair loss related to stress is called telogen effluvium, and it typically happens about 90 days after a stressful event. And so when COVID hit, I had to close my office for 9 weeks, and I told my staff, our hair loss clinic 3 months from now is going to be out of control. And it has been, and it has not stopped. 2 years going on. Death of a parent, change of a job, any major life stressor, about 3 months later, you will have some shedding. It typically resolved after about 5 months. But if it doesn't, we want to make sure that we're intervening. But I have patients like this, sadly, every week. They come in and they say this is going on for 15 or 20 years. And they never sought any help. And so the earlier you can seek some help, the better you will be. We were able to get some improvement with this lady who was in her 80s. This is really after about 3 months. I just had to make a few changes in her life. So again, with the hair loss workup, we want to make sure there's nothing else going on. This is something that any dermatologist should do or should be willing to do for you. And we can get some recovery. So this was a woman who was just scratching the heck out of her scalp, scratch. I mean, she ended up having a little bit of scarring. It was the same person. She stopped coloring her hair, but the volume of her hair has improved because she was no longer traumatizing her hair follicle with her brush every day. And so some before and afters as well. And so I will just 2 more minutes. So hair removal, we certainly can go up to the other end of the body and do some laser hair removal. So this some before and afters, which can make a huge difference from a self-esteem standpoint. Thickness in the middle. So this sometimes becomes an issue. We've got some great non-invasive options to do that. We call them body contouring. So they're not weight loss devices, but they will definitely help with that middle section, which is often cortisol triggered. I always tell my patients, really we want to get you on an anti-inflammatory diet. And so that means getting off of dairy. That means more food that comes from the ground and less food that comes from a package. There are a few movies that I suggest patients watch on Netflix. One of them is Forks Over Knives. The other one is Game Changers. And the third one is What the Health. It is all about embracing more of a plant-based diet, because every disease process that we have, whether it is high blood pressure, diabetes, acne, eczema, psoriasis, arthritis, all inflammatory. And so if you can put your body in less of an inflammatory state, it does not mean we're going to cure your psoriasis or your high blood pressure. It means that we're going to put you in a better position to manage it. And I think with that, I will just say thank you. We missed the Barbie slides, but maybe another time. So thank you for your time, and I'm open to questions.
Thank you so much, Dr. Jackson. That was a wealth of information. I have a few questions that have come in from the various platforms.
Okay.
So I'm just going to start and fire those off. First, my doctor recommended to only use mineral-based sunscreens, but they all seem to leave a cast. Is there any way to have a mineral-based sunscreen that doesn't leave the cast or ghost look on colored skin?
Yeah, so that's tricky. It's a really tricky one. So let me first talk about sunscreens. There are two categories of sunscreen. So there is a sunscreen that is a physical blocker, and then there are chemical blockers. And so the physical blockers are mineral, titanium dioxide or zinc oxide. So in the olden days, that's what the lifeguards would wear with the white nose. We now have sunscreens that are micronized, which means that they're smaller particles, so they're a little bit more elegant. With that said, that is a huge challenge with brown skin. But the reason for mineral sunscreens, is they do tend to be less irritating. So if you've got very sensitive skin, we're not dealing with chemicals. This is something that I would certainly start a child on. I wouldn't put them on a chemical sunscreen, but they work differently. And so a mineral sunscreen is more of a physical block. And so the sun comes down and it can't get past the mineral sunscreen. The chemical sunscreens are more like the game of Pac-Man. So with the UV damage, they sort of come and they chew up the damaged cells. And so the best sunscreen clearly is both of them, so a combination. But the challenge again in just having the mineral is that you have to find one that's going to work for you. And is there one home run? No. I always tell patients the best sunscreen for you is the one that you're willing to use. And so there will be a lot of trial and error. I will say that I have one in my store, so you're welcome to go to my website. But there is Elta MD has one that is a pretty good one just for mineral. There is a makeup one called Color Science, and Color Science I like because you do need to reapply. I mean, one of the things about sunscreen is it's only good for 2 to 3 hours. So if you are in the car for a long period of time, you put it on first thing in the morning, then you go out for lunch or you go for a walk after dinner, you got nothing. And so you have to make sure that you reapply. And so Color Science makes a collapsible brush sunscreen, which you can just throw in your bag and use just like a little makeup brush to reapply. But you really, really do have to reapply. You also have to put on enough. That's where most people fail. And so, they will come back and say, well, is my sunscreen still good from last summer? I'm like, why do you still have that bottle from last summer? A full ounce, if you're going to go out on the lakefront in shorts and a t-shirt, you need a full ounce, which is a shot glass of sunscreen to cover your sun exposed body parts. So that means most tubes of sunscreen, about 8 or 12 ounces, that should be gone in the weekend if you're at the beach.
Wow. With facial paralysis, also known as Bell's palsy, the nasolabial folds wrinkle early and appear exaggerated. Do you have any recommendations for this?
Botox. Yeah, so we use Botox for cosmetic reasons. We also use it for medical reasons as well. And what Botox, or toxin, I should say, Botox is a brand name. What toxin does is it relaxes your muscles. And so if we have people, and the way that this was actually discovered for cosmetic use is there is a dermatologist who is married to an ophthalmologist, an eye doctor in Canada, Alistair and Jean Brothers. And Alistair, the dermatologist, made the observation when Jean was doing injections into a condition called blepharospasm, where the eyes twitch. And they started using Botox to relax the muscle. And he made the observation the wrinkles went away. And so often when everyone is asymmetrical at some level, but for some people, it's more noticeable. So if you have any kind of paralysis or if you have a twitch, often we just need to relax the opposing muscle to sort of bring you back into balance.
Great. Another question. I never use skin blocker or sunscreen. My question is, how will I know what type to use? I'm 63 now. Is it too late for me to start? I am not having any problems as of yet. I do try and avoid the sun.
It's never too late to start. I mean, people, the longevity, people are living longer and longer and longer. I had an 83-year-old African-American golfer that I took a skin cancer off the top of his head. And so, you know, if you enjoy, you know, doing what you're doing, and one of the things I didn't mention earlier is that particularly with brown people, the driving home point for making sure you're wearing sunscreen is, unfortunately, we know that brown people have a higher incidence of high blood pressure and diabetes. Those medications will make you more sun sensitive. Your other concern is I want to be one color brown. And so if you're on antihypertensive and you're diabetic and you are going for your walk because your cardiologist told you to walk 2 miles every day and you're not wearing sunscreen, you will be asking for some help with your hyperpigmentation. And so just make sure that you get that on board. I will share with you one of my go-to over-the-counter sunscreens is made by Aveeno, and it is Positively Radiant. And it usually works very well with most skin types, but it's, you know, over-the-counter available. You can try it and see if you like it, but it's one of the ones that I recommend a lot if you just have to, you know, get started with something.
Great. Are the LED lights safe to use on your hands when getting manicures versus the UV lights?
Yes, LED is fine.
Okay. Oh, someone just put in the chat, the over-the-counter sunscreen that you just mentioned by Aveeno, can you repeat the name?
Yeah, it's Aveeno. I can actually type it in the chat. We'll do that.
Okay. I have a few more questions. The next one is laser hair removal permanent?
No. So laser hair removal miniaturizes the hair follicle. You may see the word permanent listed on some marketing materials from the laser. I don't even, and when I do my consultations, I do talk about this. The FDA, when the trials were done, basically said that if you can show for one person on this earth, you can decrease hair removal for 12 weeks, they will allow you the use of the word permanent. I think that's very misleading because once most people hear the word permanent, they stop listening. And so it is, if you read further, it will likely say permanent hair reduction, not permanent hair removal. So it's very semantical. But I always tell people, we're going to get you, I do this in two phases. The first phase is a treatment phase where we get you to the point where you don't have to do anything. And so I have women who are getting up every day shaving. We do maybe 3 to 5 sessions. And once we get you to the point where you are not having to do any more of that, then most people will probably come back once a quarter, a couple times a year for treatment. We do not have the ability now to treat gray, white, blonde, or red hair. So we have the technology, we can treat brown skin very, very safely. Doesn't mean that everybody can do it. So it's important to make sure that whoever is doing your treatment has the appropriate laser, because there are lots of lasers out on the market, but just because a laser is available doesn't mean a particular office has that laser. So safe to treat brown skin, we still do not have the technology to get, because the laser is looking for pigment. It has to find pigment within the hair follicle. In gray, white, blonde, and red hair, there is not enough pigment for the laser to find, so it is not effective. But it is very effective in dark skin with anybody who's got dark hair.
Great information. Can you reapply sunscreen over makeup?
Yes, I'd rather you do that than nothing. And so that's one of the reasons with the Color Science brush, it actually looks like they actually have a cute one that has little sparkles in it if you sort of sparkly gal, but you can just throw that in your bag. Now, makeup at some level, and this is one of the reasons that women statistically have fewer skin cancers than men, because women wear makeup. What is in your makeup? I challenge you to go home and read the makeup, which is probably on the box that you threw away, but zinc oxide is in a lot of makeups. And so you are at some level, you have a little baby sun protection anyway. One of the reasons that women tend not to get skin cancers on their lips, we wear lipstick, as long as it's not lip gloss, right? But a lot of the matte lipsticks are sun protective. And so there are definitely some things that you are already doing. We just want to make sure that we amp it up a little bit.
Great. I have eczema. Will sunscreen irritate it?
It shouldn't. But, sort of a sequence of events, you want to, and the reason the eczema gets irritated is back to the barrier. Your saran wrap is broke. You gotta get it in better shape. And so you gotta get your eczema medication in place, moisturizer, and one of my favorite moisturizers for skin in general is one made by CeraVe. I will put that in the chat as well. The reason I like CeraVe is the Cera in CeraVe is a ceramide, and ceramides are barrier repair. And the first injury to the skin is injury to your barrier. And if you start scratching, you end up getting a bacterial infection, you end up getting, just sort of spirals out of control. And so we always want to make sure the barrier is intact. And so that is one of the best moisturizers out there. So, getting your eczema medication, then your moisturizer, and then your sunscreen in that order.
Great. What is the shelf life of sunscreen?
Great question. So every company has their own way of saying when there's an expiration date. I mean, unlike food, where it has to be clearly labeled, it gets a little tricky when you're looking at your products. And I think by law, if you go onto the parent company website, they have to kind of decode that for you. But it's usually a bunch of numbers, and some of the numbers are the dates, but never in sequence. Like they purposefully make it a puzzle. And so, we will assume that stores put products out there that are not expired. If they do, usually about a year. So that's why I would not, whatever sunscreen you bought last year, you shouldn't have it actually. It should be gone if you used it appropriately. And if you didn't use it appropriately, then, and that is why you may have a problem. And so I probably would make sure that you get a new bunch every year, but you also should be using sunscreen every single day. And so it's not just in the summer. I showed you the picture of the driver. People, you drive. If you're in the car half an hour each way to commute and you're sitting on the highway, that's 5 hours a week you're sitting in your car. It comes right through the sunglass from the glass on the window.
Hey, I am a 50-year-old. I have a small dark area on my face near my cheek. How do I clear my skin, my brown skin? I think they're trying to say.
I am putting in aad.org. I mean, the short answer is I can't see it, and I also can't diagnose it because I'll be practicing medicine on Zoom, and I can't do that. And so the longer answer is I would have you go see a dermatologist. AAD.org is the American Academy of Dermatology. And that is where you will find every board certified dermatologist. And I think that is very important. There are a lot of people who call themselves dermatologists who are not. They're not even doctors. And so you want to make sure of somebody's education. And I think one of the words that I do not even allow the use of in my practice is the word provider, because the provider word is intentional to confuse people as to what the educational level is of the person you're seeing. So this is no disrespect on nurse practitioners or physician assistants. It is different training and different levels of education. And so, my analogy is if you go to the dentist, would you have your dental hygienist doing your root canal? It is a different level of training. And so a physician has gone through 12 years of school, residency, fellowship. Nurse practitioners, typically it's 2 years of school. They do not do any kind of specialty training. And physician assistants, it's 18 months. Again, no specialty training. And so they work as a team. Again, this is absolutely no disrespect to these other professions. They are meant to work as a team. They are not meant to practice independently. And so, unfortunately, I see almost every week patients who have believed they have seen a physician and they have not. I look them up, and their treatment plan is a little interesting, but it is within your right as a patient to always ask for a physician, but it is also within your right to ask whomever you're seeing, what is your licensure? And that will tell you. if they're licensed in medicine, MD, if they're licensed as a nurse practitioner, or if they're licensed as a physician assistant. And again, please, I'm not trying to disrespect anybody. It's just we want to make sure that we're getting the team approach and the best healthcare for you.
Thank you for that. I think this next question you covered by that website that you gave. Someone was asking, are you able to recommend a dermatologist locally in the Chicago area?
Yes.
If you wouldn't mind giving that website one more time.
If you go on the website, I'll type it in again. It's aad.org. And again, I will tell you, if they're not on the website, that means they're not board certified dermatologists. So that's one way of actually sort of doing your research. Secondly, if the on that website, you can actually just put in, they have a search physician tab. You can just put in your zip code and it'll come up with whoever's in your area.
Great, thank you. A few more. Is there anything that you can recommend for someone with thin nails?
Yeah. So biotin, which you will often see in every hair, skin, and nail vitamin, a lot of patients take it for the hair, but it's completely useless for your hair. So there have been studies that have proven that it really doesn't provide any significant benefit to your hair, but it helps your nails. And so I'm actually discouraging patients from taking it for hair because it can also interfere with your lab values. And so if you have thyroid problems and your primary care doctor is checking your thyroid level and you're on biotin, it can throw those labs off. But more importantly, if you end up in the emergency room and you are clutching your chest because you think you're having a heart attack and they draw your troponin levels, which are levels to determine if you're having a cardiac arrest, biotin can throw those levels off. And so there's what we call a risk-benefit ratio. You have to have more benefit than risk. And because biotin does not provide significant benefit for your hair and does provide significant risk for your lab values, there is no reason to take it for your hair. But you can take it for a short period of time for your nails. The other thing you can do, nails are really just an extension of skin. And so if we have dry skin, we have dry nails. Nails age just like the rest of us. Overdoing nail polish, all of the acetone and all the things in nail polish, you give yourself a break, preferably in the winter where you don't have to be so cute. Same thing with the toenails. If you're just sitting at home watching TV, keep a tub of Vaseline, which is truly the wonder jelly. Truly, grandma was right. So you can use the Vaseline and rub it into your nails. It's a great eye makeup remover. You can put it on as a moisturizer as long as you're not breaking out. If it ain't broke, don't fix it, but use some Vaseline.
That's awesome. How can someone schedule a consultation with you?
Well, I miss Chicago terribly. I do. So right now, give me about 6 weeks because I'm actually reactivating my medical license in Illinois. And so I will be able to do virtual consults. I cannot at this time because I don't have an Illinois medical license, but I'm in the process of reactivating it. If you happen to travel to North Carolina, because I actually do have some of my patients who do come and see me, Southwest Airlines, I'm happy to see you. But, if you, I will put, you can actually either go to the website. If you go to my website, which I'll put in the chat, there is a box there where you can send a message to the practice, and then we can just connect with you. So the website is Skin.
And the website is also showing on her slide as well, for those of you who can see it. I know we're a little bit over time, but there are 3 more questions, so I want to try and get them in. For someone with really sensitive skin, what is a good oil to use head to toe?
Sensitive skin, a couple things. So you start with the inside out. And so, again, want to make sure that you are well hydrated, that you're not taking super hot showers, that you're not using anything on your skin that will irritate your skin. get rid of the bounce and the dryer sheets and the laundry. You know, most people who have sensitive skin also tend to have seasonal allergies. So you may want to go ahead and take your daily antihistamine, especially when pollen season is up. Using products that don't have any fragrance. So that's why I like CeraVe. You can use Vaseline as a moisturizer. Getting rid of, you know, possibly putting a humidifier in your home, in your bedroom, and then also putting fabrics next to you that are soft. And so you want to avoid things that are scratchy, sort of natural fabrics. But there is another product, the line of products that I like for people who've got very sensitive skin, people who may be sensitive to fragrance. It is called, I'm putting it in here, Havana Cream. And there is one particular product in there called Road Bath Oil. And so it is not cute. It is not in a fancy container. It's been around for a million gazillion years. It's totally old school. You probably will not be able to find it in Target. You have to get it on Amazon. But it is one of my favorites for people who don't really like to use moisturizer, but also want to be clean. So it's sort of a 2-in-1 cleanser, body cleanser, but it starts putting oil on your skin.
Okay, last two. How do you suggest someone with deep acne scars start a healing process?
Make sure first and foremost, the acne is under control. And, you know, I have a lot of conversations with, we don't cure acne. And that's one of my aha moments that I came to in dermatology is we actually don't cure much. We manage chronic conditions. And so that's one of the reasons why it is very important to me to educate my patients about what is going on, because then they will better understand how to ride the wave. I mean, things are going to go up and they're going to go down. And also, I always like to have patients have some personal accountability. I can tell you what to do, but I can't do it for you. And so, you know, when patients come in and they're like, well, my acne's not getting worse. I'm like, are you still drinking milk? Are you still eating ice cream? I can't do it for you, right? I'm happy to guide you. I kind of consider myself like your skin coach, but, you know, we got to put some skin in the game, no pun intended. And I really don't like for people to be on a lot of medications. I mean, I think that I really to try and minimize that. That's the reason I mentioned those movies earlier, because every patient who I've told that about and who follows those guidelines, and personally, I went through that process about 2.5 years ago. I've been vegan for 2.5 years, and I have more energy. You know, I've never really had acne, but I just feel much better. And you know, it has been, you know, immune supports. Certainly in the space of COVID, I think that it has really served me well, knock wood. So I highly encourage it.
Thank you. Last question here. What is the best product for dark circles under the eyes?
Depends on why you have them. And so people who've got allergies often will have dark circles. So if you do, you got to get your allergies under control. People who are emotional and who cry a lot and rub their eyes, that can cause it. People who are using products that are not the best choice. Eyelid skin is a whole different ball of wax. It is the same as neck skin. It's very, very thin and very unforgiving. And so you have to be very careful about eye products, and they're really, really hard to find. And, you know, because of that, you almost get yourself into a catch-22 situation where you're trying to make something better, but you end up making it worse. And with brown skin, that is always what happens. If you make it worse, you're going to get hyperpigmentation. So the short answer is, I don't know that I can give you, you know, a one and done. I would say less is more, minimize the irritation, make sure that you have addressed any kind of underlying issues.
Thank you so much, Dr. Jackson. We really appreciate all of the advice, all of the wealth of knowledge that you imparted with us tonight. Before I hand it back over to the health and wellness team, I will be dropping a link to a quick survey in all of the chat platforms. Please take a minute and fill that out for us. We'd be very grateful. And now I'll hand it back over.
Well, everyone has said in the chat what I would like to say. This was a very informative presentation. Thank you so much. We all learned a lot. I know I did. Again, ladies, please remember to complete the survey and the link in the chat. Also, be sure to log in next Thursday, May 19th at 5:50. Our health topic will be physical fitness with Miss Ladrissa Bonneville. Thank you again. Spread the word, and thank you all for attending. Have a wonderful and restful evening. Dr. Jackson, you're fabulous. Thank you so much.
Thank you for having me. I really enjoyed it. And I will let you know. I'll send it, Sarinthia a message as soon as I get the Illinois license. Good to go.
Please do. Please do.
All right.
Care.
All right. Have a good night. Thank you.
Thank you. Good night. Thank you, everyone. See you next week.